Good afternoon, good evening, or good morning, wherever you are across the world. My name is Yaron Conforti. I'm the CEO of Novamind. Novamind was started in early 2019, and we're focused on building the infrastructure for a regulated psychedelics industry. Some of you may know a bit about us, and hopefully you'll learn more through this presentation. Continuing to the next slide, I'll be joined shortly by my partners in Novamind, Dr. Reid Robison and Drs. Adele LaFrance. They will give a bit of detail about the work that they're doing now, some of which is taking place at Novamind partnered facilities in Utah. We'll just wait for the next slide to come along. Great. You'll learn through this presentation a little bit about why Novamind is unique. One of those reasons being that we've partnered with leading clinicians and leading researchers in the psychedelic medicine space. Both Reid and Adele have their own track records of doing work in the space, and they'll talk a little bit more about the work that they're doing now in and outside of Novamind. Moving on to the next slide. So as a high-level agenda for this presentation and this panel, I'll be speaking a bit about Novamind again and giving some insight into the work that we're doing today in psychedelic medicine. And Reid and Adele will be joining shortly, and they'll talk more about the work that they're doing, including some of the work happening at Novamind. Moving to the next slide. So the following is a summary of Novamind's core pillars, distilled into 3 pillars, being clinical care research and our retreat network. I'll speak about a little bit about each and tell you about the work that we're doing. Clinical care consists of 4 outpatient mental health clinics in the Greater Salt Lake area. We entered the clinical care space through our partnership with Dr. Reid Robison, and Reid, with his partner Seneca Anderson, has been operating these clinics for a number of years in the Salt Lake area. The Cedar Psychiatry network of clinics, and these are representative of our work in the clinical care side of psychedelic medicine, are essentially outpatient mental health service clinics that many people might be familiar with. It might include a lot of traditional services like talk therapy and prescription management and psychiatric care. It also includes other alternative therapies, some of which people will be familiar with, like TMS, or like innovative therapies like Spravato. And in terms of a specialty, ketamine-assisted psychotherapy for us is in fact a leading alternative therapy for us at Cedar Psychiatry, and something that through Reid and as well Adele and his partners have developed a lot of experience at through those clinics. On the research side, Cedar Clinical Research, again, we partnered with Cedar Clinical Research based on the track record of Dr. Reid Robison. In this case, it's focused on clinical research. If you listen later on in the presentation, you'll learn more about Reid's background and some of the work that he's done. And currently at Cedar Clinical Research, we have about 5 clinical trials that we're responsible for. That means we're hosting and we're leading. And Cedar Clinical Research also operates as a CRO, or a clinical research organization, which provides contract services to other clinical trials that need those site services and specialized services at various phase development. So we expect that through Cedar Clinical Research, we'll be doing more of the work that they've been doing for the last few years. And as well, we're going to focus within Cedar Clinical Research on doing our own development of therapeutic protocols. To be specific about what that means, we are not drug developers and we don't intend to develop drugs, but rather we are focused on developing protocols around specific indications and using certain compounds where they're legal. So you'll hear more about that coming up shortly. I'll move on to describing a bit about our retreat network, and we essentially want to be in a position to provide our patients with the alternative care where available in legal jurisdictions where those treatments are medically supervised and adhere to the evidence-based protocols that we use at our clinics in Utah. The goal here is to provide access today, to provide patients with access, those people who need it the most and would otherwise not be able to access these treatments. So at a high level, you now have an understanding of the ways in which we are participating directly, and the examples, clinical care research in our retreat network, that are representative of how we're participating both in the clinical care and the research advancing psychedelic medicine. So I'll move on to the next slide. Here's a map that talks a bit about what I just described, and the opportunity exists today, which we're very excited about, is that maintaining the protocols that we use with our leading clinics in the Utah area, we can maintain and guarantee that consistent quality of care, both through accessing resources in the Netherlands. We've made a large investment through Novamind in the Synthesis Institute, which is widely known to be one of the best, if not the best, retreat centers for psilocybin in the world. We also have in our network and under development a partnership with a group called Circadia, and they will be leading retreat work as well. We expect hopefully following the COVID crisis in early 2021, when that kind of travel is made more easy. As well on the map, as I've talked about, our research clinics, you'll see specifically in Utah, and as well Cedar Clinical Research, which is our dedicated research organization, and Toronto, of course, where I'm speaking from, where our corporate headquarters is based, and where we'll partner, hopefully, with many more of the leading clinicians like we have at the early stages here of Novamind. So moving on to the next slide. I'm now very happy to introduce my partners previously mentioned. Again, Dr. Reid Robison and Dr. Adele LaFrance.
Thanks, Yaron.